I'm joined today by Baltimore County's Health Officer, Dr. Gregory Branch, who will join me momentarily in sharing updates on Baltimore County's ongoing vaccine distribution efforts. But before we do that, I cannot begin without taking a moment to reflect on what happened yesterday in our nation's capital. Peaceful protest has long been the bedrock of our republic. Our right to peaceably assemble and protest is a right that is enshrined in the U.S. Constitution. And that key tenet of our social contract has been the impetus for so much progress for our nation over the years. But what we saw yesterday at the U.S. Capitol was not a protest. It was a riot, an act of sedition and terror by a mob who desecrated our nation's capital in an attempt to overturn the results of an American election. It was a jarring assault, not just on the Capitol, but on our democracy and on everything for which we stand. As a parent, an elected leader, and as an American, it was a heartbreaking sight. It's also something we have not seen since the War of 1812, except this time, it was not done by foreign actors. Americans did this, incited by an American president. And everyone who participated in this insurrection should be held accountable for their actions and prosecuted to the fullest extent of the law. And that includes President Trump, who has knowingly and purposefully made baseless claims about the integrity of our election and who, upon this false narrative, has fanned the flames of conspiracy, encouraging the behavior that led to the storming of the halls of Congress during a session to count America's electoral votes. Now more than ever, leaders at all levels of government and of all political parties have a responsibility to speak up and speak out against this attack on our republic. They have a responsibility to affirm the work of state and local election officials, whether it's here in Baltimore County or in Fulton County, Georgia. In response to yesterday's chaos, Baltimore County moved quickly to make law enforcement personnel available as part of Maryland's response team to support the U.S. Capitol Police and their Metropolitan Police Department in their efforts to restore justice and order. I spent time with Chief Hyatt and the Incident Command team yesterday, monitoring the situation in Washington and speaking directly with our officers who were in the queue for assignment and who are ready to respond as needed. And just as our men and women in the Baltimore County Police Department were prepared to assist in restoring order yesterday, we likewise stand ready to assist any other efforts to support our neighbors in the nation's capital. To be sure, the days ahead are likely to include many hard conversations about how we arrived at this point, and we have much work to do in order to forge a path forward together. But even as we fight to sustain the very core of our democratic principles and institutions, we also continue in another fight, a fight against the deadly disease of COVID-19. It's been 10 months since our world has turned upside down. In that time, over 40,000 Baltimore County residents have been tested positive for COVID-19. More than 900 of our neighbors lost their lives to this virus. Today, we are at a critical turning point in our fight with COVID. The arrival of a vaccine has brought hope for the future. We can begin to see a light at the end of the tunnel. On December 23rd, Baltimore County received our first 100 doses of the Moderna vaccine from the state of Maryland. Just hours later, Baltimore County injected all 100 of those doses into the arms of our healthcare workers and first responders. Ms. Renee Youngfellow, who oversees all of Baltimore County's health centers and who has coordinated our COVID-19 testing efforts throughout this pandemic, became the first person to be vaccinated by Baltimore County. She volunteered because she wanted to protect herself, protect her family, and to serve as a role model for her neighbors across Baltimore County and across the state of Maryland. Renee, I'm grateful for your leadership, and I'm thankful for all of your work throughout this pandemic. Our next shipment of vaccine consisted of 3,400 doses of Moderna, received last Tuesday, December 29th. So far, 2,000 of those doses have been administered this week, and we are set to disperse another 1,000 later today. On Tuesday of this week, we received 6,825 doses of Pfizer's vaccine. We have scheduled 7 clinics for next week, and we will administer 1,000 doses to our healthcare workers and first responders at each clinic schedule. This is the process we will continue replicating going forward. In accordance with the state's vaccination plan, the Baltimore County Health Department is currently in phase 1A. So right now, healthcare workers, first responders, and residents and staff of long-term care facilities will be the first to receive the vaccine doses. And as we receive our allocations and shipments of vaccines each week, we will continue to schedule clinics so that those eligible to receive a vaccine will be able to make an appointment and receive one. We will ensure that there will be no vaccine that goes to waste. And we will continue to diligently work through the priority groups established by Maryland and Baltimore County until such time as we are prepared to allow the general public to obtain their vaccines. More information for our residents, including details on Baltimore County's priority groups and sub-tiers developed in concert with the Maryland Department of Health and health officers from across all of Maryland's jurisdictions, is available at baltimorecountymd.gov/vaccine. And we will continue to update this page throughout the pandemic with the latest information on our efforts. This is a massive undertaking, the likes of which Baltimore County and our country has never seen. In the absence of strong federal leadership, it has been up to state and local leaders to get the job done. And that's exactly what we're doing. So I want to thank you, Dr. Branch, and your deputy, Della Leiser, for their entire team of the Department of Health and Human Services for the incredible efforts throughout this pandemic, and especially right now as we begin the incredibly important work of getting people vaccinated. It's an effort that we're ramping up even as we continue other critical work, such as testing and contact tracing. But we also have one more very important message for our residents. It will still be many months before all of us can receive a vaccine. In the meantime, we ask for your patience, your understanding, and your partnership as we provide these life-changing and life-saving vaccinations to each and every person across our county. In the meantime, we also need your vigilance. People are still dying from this virus, and how many people live or die is dependent upon each of us. It's dependent upon you. We are entering into, and we hope and expect that this will be the final stretch. But the final stretch is often the hardest. The personal decisions we make matter now more than ever before. They are still a matter of life and death for us, for our loved ones, and for members of our communities. So please continue wearing your masks, continue practicing social distancing whenever possible, and continue the hard work of keeping yourselves and your loved ones safe. Together, Americans can stand and link arms to preserve our democratic norms and principles, and we can also link arms to defeat this global pandemic. With that said, I'll turn things over to Dr. Branch before questions. Doc.
Thank you so much, Mr. C.E., for your kind words. Deputy Health Officer Della Leister and I greatly appreciate your remarks. But I would be remiss if I did not emphasize all the work that our health department staff is doing. As the county executive mentioned, we received our first 100 doses of the vaccine on December 23rd. That was just 2 days before a major holiday. And we successfully vaccinated 100 EMS and COVID testers and vaccinators that same day. The entire vaccination process is a major undertaking, but one that we in Baltimore County are completely ready for. Since that first vaccination clinic on December 23rd, we have mounted several others and will continue to do so. After a visit to our vaccination clinic by a member of the media, the reporter in his coverage said that our processes run with military precision. And while certainly true, we are always looking for ways to improve. Just this week, we launched Baltimore County Department of Health Provider Registry. we invite every Baltimore County healthcare provider to register their contact information through this portal. The link to this portal is on the county's COVID update website. We will reach out to the registered providers with information on scheduling vaccinations for themselves and their staff. As of today, we launched our COVID vaccination page as part of the county's COVID updates site. We will use this page to post updates and information about the vaccine as we move through the various vaccination phases. This will serve as a primary tool for keeping our residents informed. I encourage you to visit the COVID update site often for the latest information. We are happy to have the vaccine as a latest tool in our arsenal against this pandemic. But I need to remind everyone that this is a marathon and not a sprint. Over the coming weeks, it will continue to be vitally important that everyone practices the 3 W's. Continue to wear your masks, watch your distance, and wash your hands. I need you to do it for yourself, do it for your family, do it for your community. Please, just do it. Thank you.
Questions?
So when are you going to be done with phase 1A? When will you move to phase 1B? Let's start there because I have 2 questions.
Okay. So at this particular time, we're still immunizing all of the health providers and their staff. So that number is unknown at this particular time. We don't know how many staff are in the doctor's offices, but we're assuming at this particular time that in the next couple to several weeks, we'll be able to move on to the next phase, okay? And then once the state tells us, because we can't move unilaterally, when they tell us to move, we will be ready to move.
And just so we're clear, how many doses of the vaccine have you received so far, and how many have you administered?
Okay, so we have received, I'm going to break it down into 3 allotments. We received our first 100, that's already in the arms. We received the 3,400 after that. Over 2,000 are in the arms, and the rest will be in the arms today, between today and the weekend. And then this week we received 6,825, and we have already got scheduled for next week. I'm gonna take these glasses off. Already have scheduled for next week 7 clinics to see 1,000 people. So we will be completely out of that vaccine by next week.
So it's taking about a week to get the vaccine from time of delivery into the arms of somebody who needs it, right?
It takes, totally yes, but I need you to understand something which is very, very important. We've received 2 different types of vaccines. So we've got to be very, very, very careful as to how we administer those. So what I do not want to do is, if I can prevent it, is to have multiple vaccines at the same clinic. Also, I do not want to put on open our clinics until I actually have the vaccine. That's very, very important, because one of the things, I don't know when I'm going to necessarily get the vaccine and how much. And I don't want to put the appointments out there and not receive the vaccine and then have people show up without it. So yes, I received it this week, and I schedule all those vaccines for the next week. And that's the process of how we do this.
Last question, will you or John get the vaccine if you have not?
Oh, most definitely. Oh, I can't.
Have you got it yet or no?
I have not gotten it yet, but as I start working the clinics myself, and I'm on the front line, I will definitely get the vaccine. And I'm quite sure, I don't want to speak for him, but I'm going to say I'm quite sure as his health officer that county exec will also get the vaccine in time.
If you could vaccinate 100% of the population just today, instantly, what would be the potential effect of that?
Well, one of the things you got to understand is we would love to vaccinate everybody at the same time, right? That's great, because that would get us automatically herd immunity. When you're talking about a particular organization, let's just say if you have a hospital or if you have a health department, one of the things that we cannot do is we cannot vaccinate the entire staff on the same exact day. And the reason why is because people may have some minor side effects to that. And because of that, you don't want to have all your staff out at the same time. So, great idea. We would love to do that. However, we have to do it in stages anyway. And so I think that once we get to that point where we are able to vaccinate everyone, that would be great.
Okay, thank you all.
And Phil, the answer is absolutely yes. I will be getting vaccinated
My
at the
question was
appropriate
if you
time.
hadn't
Yeah.
received it yet, I didn't know if you
I have not, but at the appropriate time. I think it's important that our health officials, our first responders get it first, and I think it sets an example that we should be following some level of following the guidelines as leaders. So wherever I fall in terms of the categories and where I should be is when we plan to get the vaccination. But I absolutely plan to get it. Thank you.
Thank you. Thank you all.
Enjoy.
Thanks, Doc.
Dr. Branch? I have a question for you.
Yeah, standard. I'm 60 years old. I'm 57. I also have severe asthma. Maryland had what? Maryland had originally 2 comorbidities in group 1B. CDC changed that. And I'm asking if there's any way, not just on a personal thing, because many people have kidney issues, things like that. You guys had it right. CDC changed comorbidities, at least multiple things, should be before some of the other groups. I'm back down to group 2 now. That isn't right.
Good deal. Thank you.
Because it should be